Let's talk about some other things that actually work. Okay, obviously, yes, delaying retirement or starting at the wrong time for your retirement benefits. So we're talking about retirement benefits, spouse benefits, divorce spouse benefits, surviving spouse benefits, whatever the case may be. That's considered retirement benefits in terms of Social Security. So in terms of Social Security, thank you for telling me the GC and Cynthia, the much better with the sound. I appreciate it. So in term that those are all considered retirement. So those annual earnings limits apply to that. So we're talking this year, it's 23,400. Anything you make over that, Social Security holds back $1 for every $2 you go over. So there's a lot of people retire and then they realize, oh, wait a second, all my checks are being withheld because I'm going over the limit. So we want to make sure you start your benefits at the right time. So I've got a bunch of videos that go into more detail on that in terms of, is your health, are you working, anybody else dependent on your benefits. So starting your benefits at the right time. I've taken hundreds of thousands of claims at Social Security, and the mantra was always getting the right check to the right person at the right time. So that should be yours as well, getting the right check at the right time. So starting it at the correct time. That's important. Obviously, working more. Most of these videos that talk about increasing your Social Security benefits, they say, wait till 70 and make more money. It's like work longer hours. Duh. But that is a reality. But what they don't mention is that cuts both ways in terms of before your full retirement age and after, because Social Security kind of calculates your benefits based on your high 35 years of earnings. And it doesn't matter when that is. A lot of people miss that. If you're 62, 72, 82, 102, then if you work and you continue to pay into Social Security, and that's one of your high 35 years of earnings, it doesn't matter how old you are, Social Security will automatically recalculate your benefits. So if you're 82 years old and you worked the previous year, and that's one of your high 35 years, then Social Security will recalculate that and give you an increase. And don't miss the younger years. So if you're 82 years old and you make $100,000 and you say, well, that's going to replace that $20,000 I made when I was 25 years old. Probably not, because remember, Social Security benefits, what they do is they take that year and they index it for a wage index. So if you're 82 and you worked at 25, making $25,000, that's probably worth like $200,000 today once they index it. So people contact me all the time coming here to the channel and they say, I worked last year and I made a lot more money than I did, when I was in my 20s or 30s, but those were indexed for inflation. So it just might not have increased your benefit amount. So remember that. So that the working more, counts ever since you work and until the end of your time. So in terms of delaying, remember, you also get those delayed retirement credits. So anytime you wait after your full retirement age for benefits on your record, it's only in this case, the delayed retirement credits, which is 8% per year, is added on. So let's say your benefit amount is when you hit your full retirement age, let's say 67, your full benefit amount is $1,000. If you wait to collect those benefits until you're 70, 8% times 3, 24%. So instead of $1,000, you'll get $1,240. So you'll get 8% delayed retirement credits every year. And what a lot of people miss, and including Social Security employees, unfortunately, because not many people take advantage of this strategy, is called voluntary delayed retirement credits. So you can start your Social Security benefits, and then once you hit your full retirement age, a few months before you hit your full retirement age, you can actually suspend your benefits to get those voluntary delayed retirement credits. And then you start your benefits up again at 68 or 69 or 70 or whatever the case may be, and you get those extra 8% added on there. But I got to warn you, when you go down to the Social Security Administration and try to do that, they might give you a hard time because not many people do it. And so a lot of the people in the front, called the customer service representatives at the front windows, don't really know about the voluntary delayed retirement credit. So you just have to push a little bit harder and, they'll find someone in the back to help you out. So, but you just have to, it takes a little battle sometimes to get that. So that's the voluntary. Another one is obviously increase your benefits. Make sure you get the right benefits at the right time. The correct amount. Make sure your benefits are calculated correctly. I'm coming up with a calculator. People asking about the website. It was going to be a simple website, but people that have been watching me for a while know, yeah, I always want to add extra stuff on there. So it's going to be a pretty awesome website that covers so much, and it's expanded out more than I anticipated. One of the calculators it has is where you can go in there and manually check to make sure your benefit is correct. So I'm going to add that as well. But as of right now, the number one way to calculate that your benefit is correct is making sure your earnings record is correct. So if your earnings record, that is when you go into, if you go into SSA.gov, my Social Security, and you click on your earnings record and see how much you made in your 20s and 30s and 40s and 50s, if everything is correct there, then you should be good, because that's how Social Security calculates those benefits, is based on how much you actually paid. And the mistake a lot of people make, and therefore they're getting the wrong benefit, is they don't check that on a regular basis. So, reach out to all the young people and tell them, hey, tax season is over, but it's not over until you go into your Social Security account and check to make Social Security got those numbers, got those earnings. Because if you catch that mistake early, it's easy to fix. If you wait 10, 20, 30, 40 years, it's very difficult, if not impossible to fix. So make sure you do it, check that on a regular basis. Okay. Some other things is wasting money on Medicare Part B. Part A is free for most people, but Part B this year is $185. A lot of people waste $185 and they've reduced their check when they don't need Part B. If you have current insurance from current work, yours or your spouse's, and obviously you're happy with it, and your employer has 20 or more employees, or if you're a large place, 100 or more employees, then you don't need to waste your money on Medicare Part B. Save your $185. Even if you're 65, people always say, well, if I don't sign up for Medicare Part B at 65, I'll get in trouble. No. If you have health insurance from work, current work, yada, 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 then you don't have to sign up for Medicare Part B. Don't waste the money on Part B. Once you stop receiving health insurance from work, current work, then you go ahead and sign up, whether it's the following year or 70 or 75 or 80. So don't waste money on Part B if you don't need it. Another thing that people that do need Part B but can't afford it, so think about everybody in your community that relatives, friends, a little old lady down the street, that they're having a hard time paying for their Part B, the $185. Tell them to contact Medicaid, and there's a program called the Medicare Savings Program where they contact Medicaid, and if they're approved, then the state, the Medicaid is called different things, Badger Care and Sooner Care and Medi-Cal, and there's dozens of Apple Care, and there's dozens, but they're all Medicaid. It's all Medicaid. They just go by different names. But if you're approved for that Medicaid from your state, and they just might pay for that $185, the Part B, and that puts $185 back in your pocket, which is always a beautiful thing. And then you're eligible for those Medicare Advantage plans. I always recommend Medicare supplement plans, but if you have a Medicare Advantage plan, Medicare and Medicaid, then a Medicare Advantage dual eligible plan might just get you some more benefits, extra dental, vision, hearing, those grocery cards you see advertised all over the place. They actually do exist. Transportation and stuff. You can reach out to my partners there at Chapter who sponsor the Q&A, which we'll start here in a little bit. And speaking of a Medicare supplement, here's another way you can save some money. It's not going to increase your Social Security check, but it's increase your, it's going to save you money every month, is the Medicare supplements. You can change those 365 days of the year. If you have a Medicare supplement, an F or a G or an N, and it's starting to get expensive, you can price that, check to see if you can get a cheaper one 365 days of the year. Depending on your state, you might have to go through health underwriting. And there's some states that, I think it was Utah, and there's a couple other states that are doing kind of the birthday rule. And in some states, it's what's called the birthday rule. The anniversary rules are different things. So states that have the birthday rule, and again, you can reach out to chapter or whoever signed you up for your Medicare supplement plan and say, hey, can you find me a cheaper one now? Because once you have a plan G, they're all the same. A plan G is a plan G is a plan G. The only difference is the price. But call up chapter whoever and say, hey, I'm paying this much. Is there any out there that are cheaper? Do I have to go through health underwriting? Is there going to be, is the state going to, introduce some type of birthday rule where the birthday rule is basically during your birthday? It depends on the state, like that month or the month before, the month after included. You can change your Medicare supplement plan without going through health underwriting. So if you move, you can change your Medicare supplement plan without health underwriting. There's all kinds of the ability to change your Medicare plan, your Medicare Advantage, your Medicare supplement plan, that it's just way, way too confusing. Unfortunately, there's so many exceptions to the exceptions. You always need, help. And, you can call, chapter or whoever. A lot of people call SHIP, which is a state agency, state health insurance programs. They provide free help as well. But JAMA just did a study of SHIP. JAMA is the Journal of American Medical Association. And they did a study where they've called a bunch of SHIP agents throughout the country. And it didn't turn out very well. So it's unfortunate. But I can never say anything bad about volunteers. We all like volunteers. All right. So you can check your price on your Medigap, your Medicare supplement, see if you can save some money there. IRMA, if you're paying higher than $185, maybe you're paying that IRMA extra charge, the extra premium for your Part A. And there's also an extra charge for your Part D if you're one of the high income earners. And a lot of people but then they had a life-changing event and they don't realize they can appeal that and get that extra charge taken off. And I just did a video on this a couple of days ago, but it's called the IRMA, Income Related Monthly Adjustment Amount. And if you have a life-changing event, you just might be able to get that reversed and get your money back. And it's the form is SSA 44. So definitely check that out. Another thing people are missing, getting the wrong check, getting the wrong program. I just had somebody yesterday on my live that said they were 71 years old and they were on widow's benefits and they wanted to know if they can switch to benefits on their own record. And yes, you can. That is if the benefits on your own record are higher. So a lot of people miss that. So she was 71 years old, so she missed many months of benefits if her benefits on her own record turned out to be higher. So that's a strategy. People file for the wrong benefits at the wrong time. They file for benefits on their own record at 62, but they should have filed for survivor benefits at 60. They should have filed for retirement and disability when they turned 62 if they were disabled. They should have filed for spouse benefits as well, but they didn't want to. I get this. This is a terrible one. People, they're getting benefits on their own record, but they are also eligible for divorced spouse benefits. But they say, well, I don't want to get those divorce spouse benefits because, my ex-spouse remarried and I don't want to affect it. They don't know. They won't know unless you tell them. And it won't affect their benefits. It won't affect their new spouse or their kids or anything like that. Doesn't affect it. And another one is, well, I would file on that person's record, but in the divorce decree said I couldn't get it. Social Security doesn't care about that. Yeah, that's no relevance. If you were married to that person for 10 years, you're eligible for those benefits. Doesn't matter what it says in the divorce decree. And so nice try, lawyers. Getting that benefit might affect any alimony or something, and that's a whole different thing. But in terms of Social Security, no relevance whatsoever. So signing up for Part B at the wrong time and getting a penalty. So if you don't sign up for Part B at 65 or when you're on, disability for 2 years, then guess what? 10% penalty for every 12 months you didn't have Part B. So a lot of people unfortunately are paying that. Obviously COLA, there's a lot of videos out there. The videos have already started in social media land about what the COLA is going to be for 2026. Nobody knows. How COLA, it's not a political thing. The way the calculations are done, political, but that's, based on how they decided COLA in the 1970s. But basically, we don't know what COLA will be until the first week of October. So any videos out there about COLA is all BS. What it is the third quarter of this year, a basket of goods will be compared to the third quarter of last year. So if a basket of goods was last year this amount, and the third quarter of this year, which ends in September 31st, is 6% more, then we'll get a 6% COLA. But so nobody could really know what's going on now until we know what's going on in September. So the whole COLA stuff is kind of premature. Don't waste your time with those. And obviously the biggest thing that's going to affect your check and reduce your check going forward are the cuts that we've known about for decades, but we have failed and our politicians have failed to prevent those inevitable cuts that are going to be happening in the future. This much comes into FICA, that much goes out into checks. Up until now, the trust fund has covered that gap, the savings from the trust fund, but those savings can't last forever. And guess what? Those savings run out that we've put away, that baby boomers have put away. That's going to run out about 2033 or 2034. So everybody's going to get a cut across the board, 20, 21, 22, 23%. So how do you prevent that cut from your Social Security check going forward? Contact your politicians and tell them to get on the ball. And what are you doing to fix it, to make sure it doesn't happen? And don't tell them, and make sure they don't give any bullshit. Excuse me, I should have said some BS. So, all right, let's see here. Let's get into your questions. Dr. Ed, thank you for your expertise. You're welcome. At 67, I may go back to work. Does my Social Security benefit stop? Nope. At 67, you can go back to making $1 billion a month, and it doesn't affect your Social Security benefit negatively at all. Remember, it just might increase it. So if it's one of your high 35 years, will it add to my benefit? Yes. Do I delay my benefit? If so, do I get widow's benefits? Okay, so you're also eligible for widow's benefits. I would definitely check that out. Here's a strategy. So you're going to be 67 soon. So what you can do is, if you've already been receiving your retirement benefits on your own record, you can suspend that. Remember the voluntary delayed retirement credits? So your check will increase 8% every year. And maybe go ahead and switch to your survivor benefits. So your widow's benefits, start your widow's benefit, call and, check out the numbers, see how much they are and see whether that's, amount you can live on. But yeah, get your survivor benefits. Work has no relevance anymore, so that's not an issue. But call up and find out how much your widow's benefits are, and then say, hey, I want to switch to my widow's benefits, and I want to voluntarily delay my retirement benefits on my own record so they will get the 8%. Again, as I mentioned, when you go in there, I would schedule an appointment and talk to a Title II CS. When I worked at Social Security before I became a manager, I was a Title II CS, a Title II of the Social Security Act. And those are the people that do retirement, Medicare, spouse benefits, SSDI and stuff. So if you just walk into the office and ask them about that kind of advanced strategy, the person at the front window said, you can't do that. And then you'll say, okay, well, thank you for your opinion. I want to talk to a Title II CS, and they'll help you out. I got Social Security survivor benefits. My son, who has autism, gets Social Security disability and survivor benefits. I don't see how we can increase our benefits at all. Is that correct? Good. I think I should have added that. One of the ways, it's not really increasing your Social Security. Well, I guess it could. But to increase the money coming to your house is, remember, if your son receives disability benefits. Remember, even though they're receiving disability benefits, he can work. A lot of people are losing money because they, it says, I started Social Security benefits and therefore I can't work. No, even if you're filing early retirement benefits, you can work $23,400 up to that. If you're receiving disability benefits, you can still work. You just have to, make sure you do everything correctly. The trial work period, as long as you stay under that, or the, substantial gainful activity. So there's a lot of people, obviously there's different spectrum from autism. So if your son's able to work, then, that doesn't affect your Social Security. So, and people, another one I hear quite often is people that are receiving disability benefits. Once they hit their full retirement age, their disability switches to regular retirement, and you're allowed to do whatever you want now. And a lot of people say, hey, I'm 71 years old. And a friend of mine said, hey, come down to my store and work and I'll pay you some. But I didn't want to do it because I'm on disability. I didn't want to lose my disability. I'm like, you're not on disability. You can do whatever you want now. My friend is a veteran, but Medicare told him he must pay the $185. The VA takes care of him with all his medical needs. Is that true? He must pay. Well, if he's a veteran, he knows that nothing is mandatory, but there are repercussions. So if he doesn't want Medicare Part B, then nobody has to sign up for Medicare Part B. But if you don't, and then you decide later that you do, then you're penalized 10% for every 12 months. So if he doesn't want it, then he doesn't have to get it. He just refused. But here's what I'm telling vets, that you're happy with the VA right now, but you can see, you read the newspaper, they're talking about cutting tens of thousands of employees from the VA, and he might be super happy with the VA now, his service and everything at the clinic, but who's to know if that's going to be there next month or next year, or he wants a second opinion or whatever the case may be. So I always recommend a fallback. And if he is low income and he just can't pay for that $185, make sure he applies for Medicaid and might be, eligible for Medicaid, and they will pay for the $185. And here's another thing. It's called a Medicare Advantage Part B give back. So there might be one available in your area where, again, you call chapter and they can check, where you sign up for a Medicare Advantage. Everybody knows I always recommend a Medicare supplement plan N or plan G, but if you're predominantly use the clinic, then probably a Medicare Advantage is probably best, because there's zero premium, and those Part B give back, exactly as the name implies, is it pays for part or all of your Part B. So you get a zero premium plan, and it may pay $50 of your Part B, or $100 of your Part B, or $185 of your Part B premium. So yeah, reach out to chapter and they'll tell you whether there's one available in your area. But be careful on those, because these are health insurance companies, and guess what? They're in it for a profit. So if you've got this plan where they don't pay for your Part B, and you got this plan that does, they're gonna find their 180. If they're paying $185 of your Part B, they're gonna find other places there. So they might charge you $500 a night for a hospital, but this one over here only charges you $100 a night for the hospital. So but if you predominantly use the VA, then, and you can switch those every year. So so you just go ahead and get that one, and then next year, if it turns out you need more healthcare, you switch over to another one.